Only if you see when you talk about insurance, women are underinsured in our country. Insurance companies are not offering, and they were not looking at women as one of the potential buyers.
You had a very successful career as a lead designer at Sabyasachi, and with the women fashion market is so big, right?
Right.
Why did you choose to build a women's health platform instead of starting a fashion brand?
I am a two-time cancer survivor. And while I was going through cancer and my treatments and everything, I think both of us as a couple, we realized that women health was very much ignored in our country.
60 to 70% women issues are preventable, curable. The two
Right.
topmost cancers in India, out of the five, breast and cervical, are 100% curable and preventable. Still, every 8 minutes we lose a woman to these two cancers.
Right.
Aditi has gone through twice.
Yeah. One thing is not really discussed broadly is miscarriages.
Yeah.
And unexpected pregnancies.
You'll be surprised to know, Navneet, 30% of our digital queries or helpline I spoke about are about unwanted pregnancy miscarriages because they don't know what to do. And they said we had a physical intimacy with our partner and we don't know, we didn't use contraception, now what will happen? So interestingly, and we obviously since have data obviously not to name, but a majority of our queries are coming from tier 3, tier 4, beyond, and around sexual and reproductive health, which is 30% of our online consultations we do. So absolutely yes.
In fact, I work with a lot of students also.
Yeah.
And I think I'm always curious to understand, what is stopping them to seek help.
I think the biggest challenge still until date and what we're trying to cover is still awareness.
We are the only few countries in the world where in organized workforce, there is a dropout of 50% women every year. Cultural reason being one, but second is health. Health being maternal health, which is around maternity time, or hormonal health as well, and especially in higher age women, menopause. Is a big issue, right? The idea is very simple: improve accessibility, make women health mainstream through including them in insurance. Third, give that level of awareness and self-care to the men.
Welcome to Femtech India podcast, where we discuss Femtech and women's health. I'm your host, Navneet Kaur. My today's guest is Aditi Mittal and Sanchit Agarwal, a couple co-founders of Newmi Care. Newmi Care is one of India's women's focused health and wellness platform and clinics. Aditi is the COO of Newmi Care and two-time breast cancer survivor. Before starting Newmi, she spent over 16 years as a head designer at Sabyasachi. Sanchit is the CEO of Newmi Care with 22 years plus experience as a management consultant and investor banker across US, UK, and India.
Here and talk about how we are shaping up women health in our country, which is obviously 50% population of the country. So very excited to talk about that.
Absolutely. So I'll start with Aditi.
Sure.
You had a very successful career as a lead designer at Sabyasachi, and with the women fashion market is so big, right?
Right.
Why did you choose to build a women's health platform instead of starting a fashion brand? Because every single girl I meet, or if you ask them in India, like what business they want to start, it typically is fashion or a beauty. I'm not against it; it's everyone's personal choice. But like you having experience or even having network within the industry.
So I think that, of course, it was my dream to be a designer. And, that's the reason why I chose this career. And no complaints. I had a great time working with Sabyasachi. And I think eventually I wanted to become a designer only.
Right.
But considering my own health journey, I am a two-time cancer survivor. And while I was going through cancer and my treatments and everything, I think both of us as a couple, we realized that women health was very much ignored in our country.
Right.
There was hardly any awareness. And there are so many cancers, especially women-specific cancers, that can be prevented, if you intervene at the right time.
Right.
So I think those realizations and the fact that women can be saved from so many more diseases, hormonal diseases, if they are aware themselves.
Right.
So keeping that in mind, and we just wanted to, we started with just this aim of saving one life at a time. That was our aim. If we could do something for even one woman, that would be great. And that's how it started. And that's how I think the switch happened between both of us, that we became super passionate about this. We wanted to create more and more awareness, make women health accessible. So that's how we left our careers at the peak and we started women health.
No, amazing. That's a really inspiring, actually. And I think over to Sanchit now. Like, in your experience, what has been the biggest challenge building in women's health, especially from personal and professional point of view?
Wow. So I think multiple challenges. First, I would say is women themselves. Women don't want to take care of themselves. It's always family first. That's
Right.
cultural part of our country, unfortunately. So women ignore their own health, and as Aditi mentioned about education and awareness. So basic things talking about to women about themselves, I think communicating that has been a challenge. Second, I would say is healthcare is a very trust-based, I would say, industry, right? So for us to build trust, and it's a slow process we discussed earlier as well.
Right.
I think people do want to trust brands, but obviously it takes a while. And third, I think is any business, if you want to build at scale, needs capital.
Right.
And definitely, while we have put in our own capital to start and we've acquired some capital, that continues to be a challenge where the broader focus of the industry, I am talking about the venture capital or the overall private equity space, health is where they want to focus, but women health specifically, we've not seen too many backers. So I think
Right.
those are the top 2, 3 challenges I would say we have experienced.
Right. So we already know that, of course, as you both explained about the problem statements in Indian market, right? How is Newmi Care working to solve these issues, like especially women specific?
So maybe I can take an Aditi, please
Yeah.
add. So we broadly have 3 businesses within Newmi. First is a digital business. Aditi spoke about the accessibility. So through
Right.
that, we are through our digital platform available in pan India. So we have customers from right from Jammu and Kashmir to Kanyakumari. In fact, places I've not heard about. Our
Yeah.
geography has improved. We often joke tier 7, tier 8.
Would
So
you
we-
mind telling these names?
Mau, and there's a place, and then Lakshadweep. We
Wow.
were surprised. Asansol, places near Srinagar, Gulmarg.
There are lots of queries from Assam, all
Assam,
these.
and all these places, and the challenge is, especially around sexual health, because
Yeah.
these things are taboo, right? And they don't want to go to the doctor next door because the family member will know about it, or they just don't have access. So
Right.
we run a free helpline, and it is supported by USAID and Wilgrow in India. That helpline,
Right.
where you get the first free consultation through a trained gynac on our platform,
Right.
and then we have other services which we provide to our customers. So that's a
So-
digital platform.
So the free consultation is for everyone in
Everyone.
India.
First consultation. is
Yeah.
for everyone
That's
in
amazing.
Yeah.
India, if you
Yeah.
can come on our platform. Yes.
Great.
So that's around 10% of our business.
Right.
Then second is we have our own clinics, Newmi gynecology clinics, women and child clinics.
Right.
We have a bunch of them in Delhi and CR. So we total have 3 our own clinics, and they are partner clinics. So these are full stack clinic. What I mean by full stack is right from consultation to diagnostic, blood work to small treatment procedures. There is an in-house pharmacy, so we have a pharmacy license, so we sell pharmacy
Right.
medicines, wellness,
Right.
health trackers, health assessments, records. So everything is all in one place. So from our user perspective, they don't have to go outside anywhere, and they're getting everything in a single place. The second aspect is everyone in India is focused on curative care, like they
Right.
cure a problem or a disease. With us, that's where we differentiate. Once you come to us, we obviously cure, But
Right.
since we collect your data, then we get into preventive care. So we have built our own proprietary tech platform called Nivrit,
Okay.
which builds on the concept of recommendation. So since we collect now needs a lot of data,
Right.
we are next time able to recommend what to do next. Let's say your hemoglobin has come less.
Right.
Our engine will tell you after 3 weeks, hey, you need to repeat the hemoglobin, or your pap smear is due, or your.
So it's automatic reminder.
Yes.
Okay. Which
Recommendation and reminders.
yeah, which usually happens in US that they
Yeah.
give you reminders of your next vaccine, and we
Because
do.
they have data. In India, the
Exactly.
challenge is data.
Yeah.
So through our platform, Nivrit, we are able to collect that data and then put to use. Right.
So is it like your own, or you have
Yes.
tie up with government as well?
So we have, that's a very interesting question. So we are ABDM compliant. So we have
Okay.
integrated with ABHA, which
What is ABD?
Atal Bharat Digital Mission. So that's
Okay.
the data and tech compliance which you need in India from a healthcare perspective.
Right.
And ABHA, which is the next big thing government of India is focused on.
How do you get that into ABD mission?
So
As a
the
company?
idea was simple that this is around digitization of records, and there is a law coming around that because the health records are personal in nature, so you cannot share further, right?
Right.
So there is a full compliance network or list of things which you need to do as a platform,
Right.
so that you are compliant to those requirements. Like in the US, you have HEPA
Right.
or GDPR from a data perspective, right? So ABHA is essentially the Aadhaar of healthcare,
Amazing.
where you are integrating all your records, and once
Right.
you have records, because you have data, then you are able to do preventive care, right?
Exactly.
So that's kind of clinics we are going to expand. Currently, we have 20 clinics in Delhi NCR,
Right.
both our own and partner. The vision is to have 100 clinics pan India in the next 3 years,
Amazing.
and we are very confident to achieve that.
Yeah.
So that's around 45% of our business. And the remaining is our women health OPD insurance or outpatient insurance. We are the it is a market first product where we have built OPD insurances product, where we work with all the leading insurers, both
Right.
public sector and private, and bundle it along with your health insurance,
Right.
which covers your hospitalization. And we have 100 plus employers, very big names like Deloitte, Accenture, Philips, Siemens,
Right.
Flipkart, Volvo, they're our clients. So we started with employers. Now we are getting into retail as well with some of the leading brokers. So that's broadly the business construct. The idea is very simple: improve accessibility, make women health mainstream through including them in insurance,
Right.
and third, give that level of awareness and self-care to women. So that's the kind of premise we are working on.
Amazing. So Aditi, you have gone through such a life-changing experience, not once but twice. What are some of the key gaps you noticed in women's health? We've already discussed, but what is it broadly in terms of not in tier one cities?
Yeah. I think the biggest challenge still until date and what we're trying to cover is still awareness.
Yeah.
Till the time you're not aware of what is, the structure of your body, what is going on in your body, you can't make out what is wrong, right? So I think awareness till date and will in future also be one of the greatest medium to, spread more and more awareness and make
Right.
women understand that if something is wrong at this level, at this stage, then you need to go out and ask for help, right? I think as women, as Sanchit already said, that we don't discuss even with each other. For
Right.
instance, a small lump in your breast, most of the women will keep watching it. They will not say it to anyone. They will not even go and disclose it to their doctors because they're scared that
Right.
what if something comes out? But they
Right.
don't realize that medical science now has evolved so much that there is a solution to everything.
Right.
But you need to catch that cancer till third grade. Then only
Right.
you can get any sort of help. If it spreads beyond that, then it's out of the doctor's control as well. So I think that this was one of the biggest challenge, and the other thing, accessibility. That if you want to go ahead and talk to somebody, who is that person you're going and talking
Yeah.
to? Because young girls particularly, and I'm talking from my experience of the queries that we get, sexual activities, they're getting engaged in it very soon, very early, but
Right.
they don't have any sort of awareness. Nobody's
Yeah.
teaching
No
them.
education.
No education.
Right.
It's only Google, and Google can tell you, even if you have like some sort of cough, it can tell you have cancer. It's so
Yes.
misleading. It can be.
Right.
So you need, for health, you need trusted people that you can go to. And that brand, that sort of thing is lacking, I feel. That's what we are trying to build. That if you have any sort of issues, if you are a woman, you can blindly trust Newmi. Go there and you will be rest assured that you will get help, you will get the right guidance, you will get non-judgmental care.
Right.
So that's exactly what we're trying to build, which is what has been lacking in the market.
Right.
So a brand needs to be built around women health, which can be trusted.
Right. And in fact, you're absolutely right, because I had few like conversation with gynecologists, and they also told me like the young girls,
Yeah.
they don't know anything about, contraceptive methods.
Yes.
Or maybe probably they're just consuming pills and they don't know the consequences
Yes.
also.
Yeah.
So I want to add on here because, in fact, I work with a lot of students also.
Yeah.
And I think I'm always curious to understand, what is stopping them to seek help. Of course, one is stigma, because they even within their group nobody knows about it. Second, going to mother is scary because we don't live in Indian culture. Then I can just go and tell my mother
Yeah.
about my my intimacy or my physical relation.
And
or
mother
my,
will also, I think, would be like, hush it. It's
Yes.
okay. It
Yeah.
happens.
Yeah.
They will still not get the right side of sort of guidance.
Right. So one thing is not really discussed broadly is miscarriages.
Yeah.
And unexpected pregnancies.
Yes.
So I want to add on here, if any young girls are listening, do you also kind of advise on that topic?
Yes.
Like someone, because they don't know and certain things happen unexpectedly, so they can probably reach out and seek help. Do you look at?
Definitely.
30% of our digital queries or helpline I spoke about are about unwanted pregnancies
Yeah.
and miscarriages because they don't know what to do.
Exactly.
And they said we had a physical intimacy with our partner, and we don't know, we didn't use contraception, now what
Right.
will happen? So interestingly, and we obviously since have data obviously not to name, but a majority of our queries are coming from tier 3, tier 4
Right.
and beyond, and around sexual and reproductive health,
Right.
which is 30% of our online consultations we do. So absolutely yes. And even our clinics and broader OPD insurance we cover, if anybody comes with their query, since we have a network and if anybody needs a treatment or a procedure, our gynecologists first diagnose, they come with a conclusion, and then if any procedure or treatment is required, we refer them to the partner hospital or a clinic where those procedures can be performed. So we
Great.
have that network in almost 700 cities in India already.
Oh,
So,
amazing.
Yeah,
I also feel that, particularly in these two cases,
Right.
I think it's very important to see where the person is mentally,
Right.
And so we do a lot of these therapies and all around this, particularly miscarriages. I think that is one topic where, women
it's
get
among
disturbed.
young girls a lot,
Yeah.
right? Yes.
Yeah.
Yeah.
So
Yeah.
we help them, we guide them through our mental health therapists also, and we take care of like the holistic health if anybody comes to us.
Yeah, I think even the mental health is part of overall women's health.
Absolutely.
You can't just separate these two things,
No.
right?
Not at all.
Yeah.
I think that
fertility, pregnancy,
Yeah.
menopause, hormone issues, right? And mental health is so big.
Right.
And we don't talk about one thing in India, I'm sorry, I just jumped, is pregnancy. Everyone talks about pregnancy, but the first 9 months is absolutely okay. Most of the folks don't get into complications. While there are complications, but the biggest issue is postpartum,
yeah.
Right.
which is where the woman needs help and she's
Yeah.
not mentally in the space and
Yeah.
in the family and the entire attention is of the baby.
Right.
So that's where our big focus area for us is as well, is postpartum care. And we as a
Amazing.
country have to do a lot.
Lot on that,
on
yeah.
that as
Because
well.
we spend lot on IVF treatments and because
But
yes,
once it has
yes.
happened, then what?
And then all attention goes to child and mother is just alone,
This
right?
is why we started our company. It was our just the experience that I had just delivered, then
Right.
I was in postpartum depression. Then they told me I have cancer. So,
Oh my
and that
God.
was the
Yeah.
year of COVID as well. The first day of my chemo was when COVID, spread like crazy and all the hospitals were shut. My
Oh, yeah.
surgeon, she declined my surgery just a day before. So it was going absolutely crazy,
I'm
and
so sorry you had to go through all
no,
of
no,
that, but
And
that's,
like,
just to add, men also goes through postpartum.
yeah.
yeah.
About this, I was under depression as well.
Yeah,
So
because you were seeing your,
And I was,
yeah,
he
trying to
couldn't
help,
heal.
and
Yeah.
I was helpless because
helpless.
there's a
Yeah.
lot of things were not in my control. So
Right.
I think for men also, I think postpartum is equally important for the couple
Yeah.
Right.
because everything is haywire,
Yeah,
right?
I actually want to add on this. My next question is on that. That, of course, I'm glad we brought this up. That even for the fertility, it's a team play, right? Like
Yeah.
when couple are going or consulting, they both are going together. So it's a journey they're both going through. So, is that your platform also has a
Yes.
support system for men, or is just a female focused?
See, so what we do is, so I think that's a fantastic question, and there are not many people know enough stats that fertility, when it comes to, it's 40% time it's issues with men and not women, right?
Exactly.
Yeah.
And
Yes.
it's the
Even
other way
as per
around.
the data, right?
Yes.
Yeah. So there's enough data and research on it.
Right.
So I think there are two parts to it. One is that from a overall non-medical health, as in through psychological stuff, by way of life, eating. There are a lot of things which impact your ovulation cycles and quality of eggs or sperm and all of that. So we do have a program called Ferticare which helps with that,
Right.
which is more natural ways and when you don't need any intervention. But having said, and then psychological health, and I think psychological health is very, very important because that is the maximum amount of time the couple is in stress, right?
Right.
In their life journey. So we do counseling, couple counseling, as well as for men and women alone
Yeah.
as well. That's one. Second, when it comes to any kind of diagnostic, we do it for both men and women because
Great.
it is as you said, it's a team effort is together. And whenever there is a procedure or let's say a IVF treatment required, then we
Right.
have partners pan India. There are quality players
Right.
where we refer both the couple and then it is taken forward from there. So the answer is yes.
Yes.
So does your insurance also covers men's health also?
No, so we don't
Okay.
cover men health because we are very, very focused on women.
Okay.
See, broadly, if you see, when you talk about insurance, women are underinsured in our country.
Right.
And when you are working for a company, group health, which is called group health, it doesn't matter if you're a woman or a man because everyone is covered, right? All employees are covered. But when it comes to retail insurance, which is where I am buying insurance myself, it's typically men who take a lead as a head of the family.
Right.
They cover themselves. After COVID, there is slight change where everyone lost lives, everyone needed insurance for their treatment. So
Right.
there is now an increased, I would say, influx of women wanting to buy product,
Right.
but still women are underinsured. So our focus is to work with, by the way, we are working with a lot of insurers to, I will not name them, but a lot of companies still don't have women-centric insurance
I think
products,
many
Yeah.
don't have.
right?
I'm not
And-
talking about younger population, even older. Like I was at the gender equity conference and I met someone from very old lady, and she said my parents are 90 years old and they never thought they would ever need an insurance, and now um, they
Yeah,
can't
yeah.
be covered because they cross
They
70.
cross 70.
That's
And-
most of the households in our country.
Exactly, and because we don't think, right?
Yeah.
And I'm like, and I asked her a general question. She said, I'm paying like whatever the XYZ amount, and she said, even in 10 years, like even if it's 10% or whatever,
Yeah.
like I'm just trying to secure my future. But she said I'm also actively working on a preventive health too,
Yes.
because
Yes.
people are becoming more conscious of what they eat, right? So I think, as you rightly said, forget about younger people, even for older ones, they don't
Yes.
have. And when it comes to like again decision making, that women have to always ask husband. Like
Yeah.
husband is the one who's doing probably
Or brother or father in the family.
Exactly.
Male member in the family.
Yeah.
That's how it is. Right?
yeah. So
but the bigger challenge, Namit, is one is people don't are not aware and they're not buying insurance, but they're not products also in the market. The
Right.
insurance companies are not offering, and they were not looking at women as one of the potential buyers.
exactly.
Now it is 50% population of the country.
But why do you think so? They were not looking
So it was historically, right? Historically, men as a bread earner.
Yeah.
In India, women population. See, today if you see workforce participation, Western world it is. Some countries are even 50% plus women participate in workforce.
Right.
In India,
Who's less?
it is less than 20%.
Yeah.
Now, especially in manufacturing, it is single digit. Services companies are still
I think
higher.
it's 12%.
Yeah.
Right. So,
Quite
so
low.
the point is when women are not earning,
Right.
why do they need insurance? That was the mindset.
Exactly.
And that's the reason there were no products. Now the insurers are realizing, and in fact, we are co-building with one of the leading private insurers with specific product around women health, right?
Right.
So yeah, I think awareness is happening, and the overall industry is evolving now.
Yeah. So tell me more about, of course, we've discussed the OPD insurance, which is you are the only company who's doing from India
For women health,
for
Yes.
women's health. Yes, right. What is the age group, and if someone wants to get insurance, what is the minimum
Age
rate?
group wise, we cover from 16-year-olds till 60-year-olds. So
Okay.
anything starting from puberty to fertilization to PCOS.
Does it cover IVF also?
No.
It doesn't
I-
cover
IVF. See, there is a concept in insurance called adverse selection, where knowingly you will, because IVF is like you want to go through IVF procedure, so you will go and buy insurance and pay the premium, and so
Right.
for an insurance company that doesn't work
Yeah.
because then people will knowingly buy it.
Yeah.
That's the reason it is not covered under insurance in India. But what
Okay.
we cover is a digital OPD where we give consultations and screenings and everything as part of the premium, as in the
Okay.
package. But the IVF process, because that's expensive, that's not covered. But the consultations and screenings and diagnostic around that.
Even the cancer, menopause,
Yes.
everything.
Yeah.
Oh, that's
So we
amazing.
have a program called OncoCare,
Okay.
which takes care of preventive. So we have access to certain tests which can detect very, very early. Aditi spoke about that it has
Right.
to be grade 3 before. Or, God forbid, you have cancer. Then again, the entire focus is in the hospital, let's say chemotherapy, radiotherapy, but nobody focuses on your mental health. That is
Right.
the time you need the most mental health.
Exactly.
Your family counseling, whosoever is around you,
Right.
the patient counseling, then the concept of onco diet in case of cancer, that what you need to eat.
Yeah.
While the hospitals will tell you don't eat this and that, but there are
Right.
proper
They
protocols
hardly
now.
tell you anything though.
Then-
Nobody talks about preventive
No.
care, right?
And the
Yeah.
moment you leave the hospital, you not even get a phone call from them.
Yeah.
Yeah.
So nobody is there to take. The recovery is
Guide you. Yes.
the recovery is the biggest part. So treatment time, you are in the hospital, you're getting drugs is fine.
Right.
But the moment, let's say, your chemo stops, now how do you recover from something which has damaged your cells completely?
Right.
So we take care of those things through our care plans.
So HPV vaccine
Yes.
comes. Oh, great! Amazing.
Absolutely. So you will be surprised to know that on a weekly basis, we vaccinate almost 8 to 10 girls. in our
Girls,
clinics
which is
on an
amazing.
average.
Which is really good. Yes.
Again, the challenge is it's cost prohibitive because
Yeah.
Yeah.
Cervavax is 4,000-5,000 rupees, Gardasil 4 or 9,
Yeah.
9 is 20,000 plus. We try to discount, so we are trying to procure the Indian vaccine, which has come through the Serum Institute.
Right.
It's still not live. But
They're rolling out
Yeah.
this year, right?
yeah. So
Vaccine.
the idea is, and that will be in the price point of 500 to 1,000 rupees.
Yes.
So if that comes in, I think that will be a big thing for us as an Indian, as a community, because
Then more and people
more and more people can access
come
it.
forward.
Yeah, they can use it. Yeah.
So you're actually a digital first platform, and you now switch to offline clinic model. What made you decide that, and how has it impacted your company's growth and reach?
So we would call ourselves digital. Right?
Okay.
What it means is essentially, right? You're right. So digital first helps us in accessibility and reach. We can be pan India available. But one thing we've realized, healthcare is very personal, right? And healthcare is very trust based.
Right.
And we are a trust deficit country. I'm sorry to say, right? And once you have a physical center, and especially in gynecology, what we are doing, right? There is a need for physical examination.
Right.
40 to 50% time the doctor would want to see you. So I don't know how many of we have two women in the room. How many times you have taken a full online consultation, and if there is a protocol to follow, you have to actually visit.
You
right?
have to, yes.
You have to eventually visit, let's say, even a pap smear done or any test done, right? So the idea here is to build that awareness, as Aditi spoke earlier. Be available digitally for your first, second consultation. But if there is any help you need, there is a physical ecosystem available.
Right.
And in the process, we are able to build trust as well, right?
Right.
Because there's something tangible there, right?
Yeah, it's like a safe space for women where they can come and discuss, even if they don't want to get any treatment done. But if there's anything they want to come and discuss, they should know that there's a space they can go and do.
Right.
And given we are a brand and we are not the next neighborhood gynac your mom or your
Right.
sister knows, we are at the end of the day neutral brand, and we focus very, very big on data privacy.
Yeah.
To the extent we have very few platforms in the country which is HEPA, GDPR, and ISO compliant,
Okay.
which means data is like very, very secure with us, right?
How do you get these for anyone who's listening and probably?
So there is a full process around it,
Okay.
compliance. So there are guidelines which the tech platform has to comply to.
Right.
So we have invested in that. So obviously there is time, effort, and money which has gone in defining those processes to be
Right.
compliant.
How big is the investment?
So it depends on the nature of the platform, but
Right.
but obviously from an Indian context, it's at least 50 lakhs plus, where you have to invest that kind of money to be able to comply to these global standards, right?
Right.
Now, in terms of growth, right, you asked, definitely that has added significant growth. I mentioned earlier it is 40% of our business now.
Right.
Because now there are significant amount of walk-ins. You will be surprised to know, since we are an enterprise, a new enterprise, our customer acquisition costs are as low as 40 rupees. Where digitally, when you try and do it's 2,000, 3,000 rupees, but in physical, because of reference, word of mouth, the customers are coming on their own as well. Obviously, we do some hyperlocal marketing, BTL, below the line marketing.
Right.
But once the customer comes or patient comes to us, post the visit, the entire journey is managed on our app or platform. And that's the reason I call ourselves digital, right? So all your records will be visible in our app, all your prescriptions, your lab reports, everything will be available in the app. And then you start getting reminders about your next appointment, your next test. So we're kind of building a phygital platform where you have ease of use and access. But in case you want to physically be there with a doctor and show yourself, so we have a infrastructure for that as well.
So, tell me what all is available at your offline clinic. Is it just a consultation or?
No, so as I mentioned above, this is a full stack clinic.
Right.
So right from consultations to any kind of blood work. So we have phlebos who sit in the clinic, and we partner with the leading labs in the country where your sample can be taken. We do 6,000 types of tests in our clinic. The rarest of the rarest test, even genetic tests, stem cell, whatnot. We have partners. So our staff is trained to draw blood. That's one. And then the sample goes to the relevant lab. Or we do home collections as well. In case it's fasting test. Then we have a pharmacy inside the clinic. Then we have a wellness studio. Where we do some level of weekend classes around, let's say, prenatal yoga, postnatal yoga, whatnot.
Or anything educational also. We do sessions with doctors also.
Right.
In that
a
space.
general physician visiting, a mental wellness or a psychologist visiting. So anything around wellness is covered there. We started keeping small products as well. Now, eventually, the idea is to have very specific women health products around supplements and all. Then we have devices where, if required, somebody wants to there is a need for that. And the last thing is, as I mentioned, the assessments. So where we capture a lot of your data and we rank your overall health on various parameters and say you are in high high risk, medium risk, or low risk. If it is
Right.
high risk, we need immediate intervention. If it is low risk, then we are okay and good to go. So it's a
Right.
full stack platform, what we offer in our clinics.
Great. So when you compare that online to offline, so you think offline, of course, works out better for you. Did that also help you to raise your funding?
See, that's capital intensive. So when
Yeah.
you come to
It is, yes, yeah.
capital, raising capital, not everyone has a thesis on that.
Right.
Because one, it is the ROI time period is more elongated, right?
Yeah.
Because you're putting an infrastructure, and everyone, especially in the VC world, wants 0 to 100 in 1 year versus
Right.
5 years, right? So I would say it's a mixed.
It's a mix.
It's a mixed reaction. I think there are some believers or backers,
Right.
and obviously there are funds who are only digital focused or who are focused on anything which is AI. That's become the buzzword nowadays.
Right.
I think the good part with us was all our verticals are unit level positive as a business. So we have had very strong fundamentals which help us. And I think we as founders, given we were tenured, we were able to put in our own capital as well to start.
Right.
So I think for us, starting was easy.
Yeah.
Because we didn't go out for capital to start.
Exactly.
To grow now, we are raising capital or we raise capital.
To going into offline models.
Yeah.
Yeah.
So I think
Yeah.
that's
The plan is to open almost 100 clinics in the next 3 years.
Yeah.
And Abhi, right now we are only doing Delhi NCR, but we plan to branch out
top
to
20 cities.
top 20 cities in
Amazing.
India.
So, how is the B2B market in India, and how has been your response? You also earlier mentioned few names,
Sure.
your partners, and what is the response that overall employee health?
So I think it is beyond our expectations. So we have acquired 100 plus clients in just a span of a year.
Wow.
Fundamentally, there was a white space or a gap. See, today when we look at employee health or wellness, it's concentrated around providing certain discounting or benefits to employees or do
Right.
annual health checkups. That's where the employers are mostly spending money. What we have done is we have specifically focused on women. Now,
Right.
every company, if you see, now has a diversity goal, saying, like in my previous employers, we had 35% goal of, acquiring women talent and retaining them. So we are the only few countries in the world where in organized workforce, there is a dropout of 50% women every year. Cultural reason being one, but
Right.
second is health.
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 Health
Yeah.
being maternal health, which is around maternity time, or hormonal health as well, and especially in higher age women, menopause becomes a big
Yeah.
issue, right? So most of the employers are now looking for solutions which are focused on attracting women employees and retaining them. And especially it gets accentuated in manufacturing. I was with recently with some auto manufacturers, and they are looking this as one of the tools to, like Ola did, for example, the entire factory in Chennai is women centric now, but they need a solution around that.
Right.
So one thing which has done in our favor is there were employers already looking for such solutions, and there were not many solutions available in the market. And so our programs, which are focused on the entire journey of a woman right from puberty to menopause and cancers, it becomes a good fit. Now, typically, the way we go to the market is through either bundled with insurance, I spoke about. So, from an employer perspective, they also get benefits from a tax and all of that. Or we work with a lot of leading insurance brokers who sell these large insurances, or it's called GMC or group medical cover, and our programs are bundled. Third is where it's like a co-pay model, where part the employer is paying and the part employee is paying.
Okay.
Yeah.
So we have a bunch of employers where it is co-pay.
Right.
And the fourth model is where the employee, it is listed as a benefit. Now, let's say the retail price is X, but since we are partnered with your employer, it's X minus Y, right? So we have those kind of models. total, we've been able to impact 50,000 plus lives through this. And a lot of employers give this to spouses of male. So, one, it is women employees themselves or spouses of male colleagues. So, we do
They're also buying for their
buying
partners.
or for them sister or mother. So anyone in the family gets
Right.
covered. Any women, and everyone would have women in their families, right? And the second thing we do. So this is one which is our OPD programs. These are digital in nature. Pan India. As I said, we have 100 plus employers now, and very very big, large employers. We recently acquired an employer who has 4.5 lakh employees in India, 450,000 employees in India. So it's a massive user base.
Right.
The second is we do a lot of education and awareness sessions
With the corporates?
with the
Yeah.
corporates.
Okay.
And one of my favorites is he for she. I call it myself, right?
Okay.
Educating men,
Men
about
about
women
women health.
wellness issues at workplace and at home. So that is one of our very, very successful series, he for she series. That is what we do. Third, we do a lot of camps, preventive screening camps around cancers, be it breast cancer, cervical cancer, vaccinations. We set up infrastructure in the office premises
Right.
and deliver those services. Those are some of the key things we do. And we do also a lot of CSR wherever there's a company with a CSR budget and they want to spend on women and child health. So
Right.
we have programs where we have done sessions in Sangli to, the remotest part of the country around screening, educating, antenatal, prenatal health, and all of that stuff. So I think those are some of the things we do. And last thing is what we do is also we partner with the other health players. So they are not our competition, some of the leading health players in the country, where they do horizontal health. We are a vertical, we are very specifically women health.
Right.
So if they have to bundle a women health solution, we provide them through their interface.
Great.
So from a user perspective or employer perspective, they're onboarded. They're already onboarded a health partner, and we just get
Bundle up.
integrated for women health.
So these are all, I'm guessing, the larger organizations.
Larger health players, yes.
And what about the smaller ones? Do they see that or?
So see, everyone needs it.
Yeah.
And nowadays there is also a lot of employers have DEI budget, diversity, equity, inclusion budget, which they want to spend, and these our programs are one of the best suited for that. Having said that, I think all smaller, I would say, from an Indian context, 500 crores less companies revenue, they obviously it's an additional cost. So where we are seeing an uptick of more employee paid at a discounted price in the market. So we are seeing an uptick. So employers are taking it. It's just that who's paying for it.
Right.
But I also have to add here that, our plans, they are so comprehensive, and the utilization that never used to be more than 20%, we can see now 40% of
60%,
utilization.
40%. Some clients we have 70% utilization.
Yeah.
Which is unheard of.
Which is unheard of because they find that, of course, there is something in those plans that they find of value, right? Otherwise, lots of spouses, they get these plans and nobody utilizes them.
So I'll give an example. When we were kind of pregnant, I got it from my employer. We didn't use it.
We didn't use it.
Because I didn't see any value in that. Because it was very simple teleconsultation with a general physician or write an email, you'll get a response.
Yeah.
But our plans, as Aditi said, are very, very comprehensive.
Yeah.
And they actually...
And personalized.
And we do measure ROI, by the way. So there's a before after. So we actually show value.
Right.
And eventually it helps employers in productivity, efficiency, reducing the insurance next time because we are helping them from hospitalization as well, right? So all those things. That's the reason we saw a significant uptake.
Great. How has the women's health market changed since you started, and what opportunities do you still think are untapped?
So I think that change-wise, definitely there's a lot more awareness now. Women are themselves looking into their health. What, as you said earlier, we are being very mindful about what we are eating.
Right.
We are being mindful about exercising. We are being mindful about our tests and diagnostics and everything. So I think that's definitely a change, but that's a change in a very small percentage of population, that
Right.
we see. Most of tier 2, tier 3 cities still, this is something that we need to work on, right?
Right.
So I think challenges utne hi hain, but I feel that awareness बहुत ज़्यादा बढ़ गई है, and because platforms like ours also, there's so many platforms that are now talking about women health.
Right.
Even gynecologists themselves have made social media
Yes.
handles where they're talking about women health, which is great because everybody is coming forward to do that.
Right.
So challenge will still stay awareness only, but I think that we've come a long way.
What about the pricing, you think?
Yeah.
I want to add on this because India is price sensitive market.
Yes.
If you really want to capture, the
Definitely.
entire demographic power, which is huge in India comparatively other countries, right? And what do you think that in terms of pricing?
So I have a very controversial view on this.
Yeah.
Healthcare is never price sensitive.
Yeah.
Okay.
So today, you never go and ask for a discount from any doctor. Say, hey, give me a discount on my consultation. We service so many customers, and when we were going through our health issues,
Right.
you go to any hospital in the country. People from tier 8, 9 also would have sold up their lands to come and get the best treatment because it's about someone's life.
Right.
So I have two very contrarian views. From a philosophy perspective, healthcare should never be a loss-making business. It's a demand-supply game.
Yeah.
In India, there is more demand than we can supply from an infrastructure perspective, from an accessibility perspective. Second,
Right.
it is not a price-sensitive market. Today, you want the best healthcare, quality care, a person who will listen to you. You will take a loan
To pay for it.
pay
for
for
it.
the best treatment.
Yeah.
So whenever somebody comes and says, hey, this is not affordable, I think our philosophy is very, very simple. It has to be quality care and people will pay whatever you ask. Right?
Yeah.
Now the point is, are you able to provide that quality care consistently? I think that's the bigger issue or question. Otherwise, all these bigger hospitals, you will not say queues and waitings and all. And
Right.
we've been in the US, UK, and all. There isn't a strict appointment. You don't see queues. Why? Because
Right.
the demand and supply is comparable.
Right.
In India, there is a deficit.
Yeah.
Right?
Yeah.
So I think healthcare is one place we believe is not price sensitive. It is more about the quality of care.
But as we also say that we are not the Mercedes of the market, we are the Honda City.
Yeah.
So that ways we are price sensitive. We are very mindful about what we are doing.
So
how
I
we are
meant was
doing
like
it.
in preventive care because we are not preventive care country, right? So we will
are
pay.
getting there.
Yeah.
It is
Yeah,
expensive.
true.
See, preventive care, why we are not. So it's not about we don't want to be. It is
Right.
about today also 90% or maybe higher, 95% prescriptions are written by hand. So you don't have data. And that goes in your file in your house, and then the healthcare.
So the
Forget about
doctors
doesn't
still
have it.
write that.
Yeah.
Right?
Even the biggest hospitals.
Yeah.
So I'll tell you, no. And hospitals are the ones which have some data.
Yeah.
But they will not do preventive care. Nothing against the hospitals because they are high capex model. They want you to get admitted, and that's how their business will work.
Exactly.
So hospitals have the most data. But beyond the hospitals, you don't have clean data. I always call it garbage in, garbage out. So anyone who talks about AI, preventive care in India, first get me clean data. Then we will talk about preventive care.
Yeah.
Right.
So that's what our attempt is, that once you come to our clinic, when we are
Yeah.
collecting data and we digitizing, that's the reason we call it digital first or phygital, then we are able to build something on top of that, right?
So that means you're also kind of trying to understand the preventive care model through your digital first platform.
Yeah.
Yes.
And then
Because
get
we are collecting data.
Yeah.
And through that data, we are training our engines to, be able to give you early signals, right?
Right.
But eventually, the idea is to reduce hospitalization.
Right.
That's where I think the idea is to reduce hospitalization, right? Now, the other thing I think we were talking about in terms of who do we serve, Aditi mentioned, right? We're not the Mercedes or the Honda City. So you see the income pyramid. We leave the top 3%.
Right.
They anyways have access. people like you
and enough options.
enough option and opportunity. The bottom 2/3 of the pyramid, which is 30%, is taken care by the government.
Yeah.
That is where players like us won't be able to get in or also make money and being very transparent. So what we service is 2/3 of the pyramid, which is approximately 67% of the population of the country. So anyone beyond, high income levels to medium income levels, you eliminate the high income levels, you eliminate the completely below the pyramid, below the income levels, and then the center of the pyramid is what we're serving. And that group is willing to pay for good quality care.
Yeah.
Right. And how about what kind of partnerships you do in terms of IVF? So you're not trying to become as a fertility clinic. That's for sure, right?
We are not a competition, they are our partners.
Yeah.
So it's simple. We have all the leading IVF providers in the country are partners.
Right.
And as I mentioned, if let's say a patient comes to us either through digital platform or clinic, and fertility is one of the issues which is diagnosed.
Right.
Now we help them with all the assessments around that, basic kind of queries around that and everything. And let's say the outcome of the entire assessments and conversation becomes that one needs an IVF treatment, then we refer to our partner, depending on which location in the country you are. And through us, we have predefined packages with our partners, so they get some benefits they get cash discounts and stuff like that.
Yeah.
So IVF clinics are our partners and not our competition.
Yeah. So as we were talking about the data points and research, and you mentioned that being a digital first platform, you're trying to gather the data so you can work on preventive care model, right?
Yes.
More effectively. What does your data say about women's health overall? What are the biggest gaps or what are the challenges they are facing?
I think today most important thing is hormonal issues. I think every woman in whichever age category you see, once they start their periods, post that, because of the stress levels, because of the environment, lifestyle, everything, I think hormonal changes are just on the top of the pyramid.
For everyone.
For everyone. All women
Girls
you
have
see.
started menstruating at the age of 10, or
Yeah.
let's say 16.
Even 5 or 6 also.
Oh, wow.
Yeah,
Yeah.
they're
There
6
are
years
some
old,
cases,
8
yeah.
years old.
Yeah.
So, everything is coming early to us now. Menopause that used to set in late, now it's coming a lot earlier.
Late
So
30s,
that
Right.
means
40s.
you need to live with those symptoms for a greater number of years,
Right.
So I think hormonal changes would be at the top of the list. And second, I would say is sexual wellness and menstruation. I think these 2, 3 things are on top of the list.
Actually, and everyone believes that women health is equal to maternity or pregnancy, which is absolutely wrong.
Which is so
We have
much
enough
more.
data,
So much more.
and that's only 10% of the market.
Yeah.
And now,
everyone goes after
and
that.
I think that now women are not even choosing. So many women are not even choosing to become a parent,
Or
right?
becoming
Yeah.
late.
So-
Becoming parents late.
I know many women, they just don't want to.
Yeah, so I think
Be
women
parent.
health as a category is very, very vast, and we need
Yeah.
to, look at it from a holistic perspective and need to see that everything is relatable. Like if you are getting treated for PCOS, let's say, your fertility will be better,
Yes.
right? Then your pregnancy journey will be impacted. Then
Right.
your postpartum
Postpartum, yes.
is impacted. So
Yeah.
everything is related to each
And
other.
even cancers, right? So 4% women globally get breast cancer post delivering a baby.
Yeah.
This is a known fact,
Right.
but nobody takes care or talks about it.
Yeah.
Like we have an instance in the family. Her cousin just delivered a baby, and within 6 months, she got diagnosed with stage 2 breast cancer,
Yeah.
and it's becoming more and more common. So all those things are much bigger than what we talk about as a market, like pregnancy
yes.
or maternity is a market.
These
for-
are all things comes into, like, I would say, after pregnancy, postpartum,
yeah.
typically, right?
Yeah, that's correct.
Yeah. And okay, so if someone has menstrual cramps, they come to you, like, how do you help them?
So, first we understand what is the frequency and like For instance, have they just started happening or have they been happening since you started?
Right.
What is your diet? What do you eat? How much stress do you have? What's your lifestyle? What do you do in a day?
Right.
All these factors we look at. And then, of course, based on that, we diagnose the patient. If there are any blood tests to be done, then we do that. If there's a gynecological examination, then we refer to a doctor. So, yeah,
And
that's
any medication that
any
is written,
medication.
Digitally, the prescription
Yeah.
goes. If it is through a digital platform, clinic
Right.
obviously you get the prescription in hand.
Yeah.
But
So-
a lot of females, if they take conception pills, that really helps in their cramps. But uske, what are the side effects?
Side
At what
effects,
age
yes.
you are, in what life cycle you are at that moment? Are you planning to conceive? Are you not planning to conceive? So there are lots of factors that come
there are
into play.
devices which have come, which ease out. There are a bunch of players who are in the market now. We are
Right.
actually partnering with few which are
These
more
patches
pointed,
that you can put.
patches or solutions which are more pointed for as a momentary relief.
Cramp relief.
Right.
Relief and also there are solutions.
It's a big issue, right?
It's one of the biggest issues.
Yes.
I think
think-
irregular periods and heavy
the menstrual
bleeding and
cramps.
menstrual cramps
Cramps.
are a lot.
Which I think most of the doctors earlier, I mean, till my age, all my friends, we have always heard that it's okay to have them, right?
Yes.
But it's
even-
actually
yes,
not okay.
It's not.
No.
Yes.
You don't have to live
You
with them.
don't
You
have
just
to.
have to make a phone call, go visit a doctor,
Yes.
and it'll be solved.
My doctor gynecologist told me 3 times, once you have a child, it'll go away.
It'll go away.
So I'm like, I have to conceive to get rid of my pain.
Yeah.
Right?
Yeah. And that is like,
But it has not gone away for her, for example. She still gets bad and she's a mother. So I don't know.
Yeah. See, honestly, it never goes
It
away.
never goes away.
I
You
don't
have
know,
to live with it.
What's the science behind it? But
no, but you need to go to a doctor. I think
Yeah.
that a doctor will be able to rule out a lot of other things, which they should rule out, and then give you prescription medicine.
Yeah. So, Sanchit, as a man working in women's health space, have you ever faced any bias?
So fortunately for me, the answer is no. I would say 2, 3 things. One,
Right.
I'm very, very passionate, right? I left my career and I've lived that
Of
journey
course.
with Aditi over we've been married for 17 years now. And so I lived her journey very closely. And I read a lot. So I can talk the language women talk, right? And this is something when we were starting, I was very conscious of.
Right.
So I think that, and the third I spoke about he or she. So I'm a very strong believer of that philosophy that men need to support women. And culturally that is changing, especially in top 20 cities, major
Yeah.
families.
Right.
And and more men are actually taking interest.
Exactly.
In fact, you won't believe 15% of the consultations which are booked in our clinics or on our platform are booked by men.
Yeah, for their wives or
That's
their
amazing.
girlfriends.
Right?
So these are from tier 1 cities?
Tier 2, Tier 3.
Tier 2, tier 3.
And men are booking consultations and we're like, we don't sell this men. No, this is for my girlfriend or
Or wife,
wife
yeah.
or spouse or sister. Right? So that's very encouraging. And I think in the ecosystem, I have never, in fact, I've been more welcome because, men, it is
Talking about
talking
women
about
health with
so
that much of
openly
passion.
and that passion. So I have been welcomed everywhere. So that's what.
Yeah, he's the favorite in my girlfriends. They say even if you don't come, send Sanchit because we would like to discuss.
Of course, because he knows so much.
Yeah,
about
he
it.
And I can
talks
talk
about
and I
it
can talk
openly.
about their passions and all
Yeah.
everything. So I think that's also.
Yeah.
I mean, I have not,
Yeah.
and I'm hoping other men also don't.
No, I also noticed like men are actively out there,
Yeah.
which is such a good thing,
Yeah.
right? Like, even for me, like, I just don't care which gender is building as long as they're building and solving problem.
Yeah.
And, all of us are getting better health access.
Yes.
Why not?
Why not?
Right?
Exactly.
And you have like diverse teams, and I think diverse teams do amazing work.
Yeah.
You need to have a different perspective.
Yeah.
Right.
We
Totally.
Yeah, exactly.
Age-wise also, gender-wise
Yeah.
also, I think perspectives are what makes a business.
Yeah. And Aditi, like for you, it's like maybe when you were part of investors meeting, did that question come up like you're a couple? Did you guys face
Always.
any chat?
Yeah. That
Every single time,
Yeah.
if not openly, but you could sense it.
Yeah.
I remember that as soon as we used to say that we're a couple, something used to like
Switch
switch off. or there was like a silence in the room that, oh, you're a couple, so you know.
And on camera, I'll share. So I've been a banker myself, and we had
Yeah, we're just gonna come back. You were in the investments.
yeah, space.
Yeah.
So I have a good network there, but I thought it'd be easy for us to raise capital on camera and saying we got 222 rejections.
Yeah.
Which is I have it on Excel.
Right.
There are many which are not documented. So we have a
Right.
list of 222 people who
Right.
rejected and said your idea is bad. And
Yeah.
it's not. It's
No,
not
no, they didn't say that your
As
idea
in,
is
it's
bad,
not investable. for
but
us.
they were like, it looks like it's not scalable,
Because the
and
market is fresh.
yes,
Yeah, nobody has
it?
done that.
nobody has
Yeah.
done it before. So
And whosoever has done has not been very successful.
Right. So I think you are the only leading platform in India now in offline and online digital.
we would like to believe so.
Yeah, I think so. That's great. So how do you maintain good work-life balance when you work and personal life are so closely connected?
So for me personally, earlier I used to do, and I know there's a debate around 70-hour week, 80-hour week, right?
Yeah.
Everything. I used to do that. But consciously from last 6 months, I made it a point beyond 9 p.m. I don't work typically until unless it's urgent, and I take Sundays off now.
Me too. I take Sundays off.
So
Yeah.
Saturdays obviously we work,
Yeah.
but Sundays I started taking off. Obviously there are few working Sundays, but that has helped me at least keep myself sane and
Yeah.
spend time with, as in we spend personal time and our son.
Right.
Because he started banging me. He's like, you're not spending time with me, right?
Right.
So I think it always says, right?
Yeah.
Startups are a marathon, not a sprint, right? So we have realized that it's true because it starts taking a toll on your health.
We are also
Okay.
late parents, so
we are
for
late
us,
parents,
everything has come together, suddenly.
Right.
So for us, these are my son's prime years also. He
Right.
also needs our attention. So I think that since both of us are in this, we also divide our time in a way that one of the parent is spending time with the child, and
Right.
yeah, we take out weekends for ourselves, and
And we don't work in the same cabin as in
yeah,
cabin.
Great.
Then there are definitely fireworks.
and we also do concentrate on completely different aspects of business.
So that's
We have made that
Yeah,
very,
because
very
you
clear.
both have different
Different
Yes.
skills.
expertise. Yes,
Yeah.
right? Yeah.
So we don't intervene in each other's space much.
Yeah, we don't. But we discuss everything. Dinner table, no conversation about
So
business.
that is a very good thing. We have made a rule
Right.
that whenever you're having a meal outside or at home, nothing about work.
We will not discuss
We will
work.
discuss work. So
Yeah, I
that has
think
worked.
great.
That
I-
has worked.
Yeah, because I think that we felt that we were getting completely consumed in
Consumed
this,
in it. And then
Right,
the fresh
that
thinking
happens.
doesn't happen.
Yes.
And yeah, we needed a break. So
Yeah.
I think that instead of taking like a break, if you do these things on a daily basis, then that helps.
Small bits work.
Small.
Right. Great. So, what advice will you give to someone who wants to start women's health company in India? It could be for students or even any global companies who probably looking at Indian market.
So see, India is a very, very different market. We spoke about through the session, right?
Right.
It's a very, very high trust based market when it comes to healthcare, and it's a very big referral market,
Right.
right? Also, it is a very highly, I would say, kind of when it comes to digital health. Most of these metas and Google actually ban a lot of keywords from a promotion perspective. So it's a very, very, I would say, a difficult market. So one thing when you are looking to build in India, one, understand your consumer. Who's your target consumer? Number one, in my view. Second, uh, the product has to bring some change or some value.
Yeah.
While it's easy to talk, but the product actually has to add some value because otherwise, as I said, it's a very cluttered and fragmented market. So there are enough players. And third, you have to understand who are you solving for? Is you're solving for the entire journey, or is it you're solving for a specific condition? Because I think that is very, very important from when you're trying to scale. Because, as I said earlier, India was taken only as much. Women health is equal to maternity still in India.
Right. Yeah.
But if you go out and see, that's actually only a small part of the pie.
Even in the B2B space, right?
Yeah.
Yeah.
Yeah, so till now you've only heard maternity insurance or
Right.
maternity cover being provided by employers. Now employers are providing PCOS cover, menopause cover, and everything, right? So I think, in my view, it's a very complex market. And the last thing I would say, you need to have tremendous amount of patience. This space needs not months, years to build.
Right.
And don't expect that today I start building, 6 months I will have 1,000 users. 1 year I will have 100,000 users. That will not happen. Virality will not happen in healthcare,
Right.
at least in our experience. So
Because it's personalized also, right? It's you
Yeah.
can't really put one formula to all, right? So I
100%.
think
the
it's
scaling
slow.
up takes time. That 0 to 1 will take time. 1 to 10 and 10 to 100 will happen. Is the other way around as compared to other industries, right? A lot of industries, 0 to 1 is quick and 1 to 10 is very, very quick. Here, 0 to 1 takes a lot of time.
Yeah, because you're building trust.
We are building trust, but after that, that multiplies.
So
I
you need
think-
to be really
Right.
passionate, and
Yeah.
you need to believe in yourself and your idea that this will scale up, and keep doing your research. And yeah, I think these would be some key.
What's
things.
your addressable market size?
So see, it's full India, as we spoken
Yeah.
about, and India overall is a $30 billion plus healthcare market, much bigger, but there you include pharma and everything else. But at least from our perspective, we are looking to be from an Indian currency perspective, a kind of 100 crore company in 3 years and a 1,000 crore company in next 5 years. That's what we are aiming.
Right.
And we believe we are on track for that, because, as I said, it's a big market, open market. And I think Aditi mentioned earlier about a lot of players, the market changing, and I always give example of these hail-riding taxi apps, right? But till the time Uber, Ola were there was no market.
Yeah.
Now
There's so many.
there is Blue Smart and everyone, right?
Right.
And everyone is surviving and doing. So same as women health. I would say till 3 years back there was no market. In my there was, as in you have mother and child
Yeah.
hospital, and
Right.
IVF has been a market a bit, but now I think with awareness happening,
I think last 2 years there has been an incredible rise in women health companies, who are
Right.
talking about women health, and I think we need that as
As an ecosystem.
as an
Yes.
ecosystem to grow together.
100%.
Because you need to make that sort of demand. You need to
and you
create
need
that
both
sort of.
services and product companies.
Yeah,
Right? There are
right.
a lot of product companies which are coming. Now we are a services company.
How can you collaborate and partner, right?
Partner, right?
Yeah.
So as I
Yes,
said, we are
yeah.
working with some product companies, both in India and outside. So I think it has to be an ecosystem play. Healthcare is always an ecosystem play.
Right.
So the opportunity is there. In my view, there are 10 players who will come like us.
Yeah, and
Everyone
we'll
can-
all grow together.
Everyone will grow because the market is really big,
Yes.
right?
Yeah. And we don't, and we believe that the competition is good for us.
Yeah, it helps us get better to what we are doing,
What we're doing, and then there is more awareness.
yeah,
There are
Totally.
more buyers, right?
Yeah.
For our service. Yeah.
So the most exciting part for me is that because all of us are educating the consumers,
yes,
right? Which people were just not even aware of HPV
Absolutely.
vaccine, period tracking, preventive care, breast cancer.
not at all.
At least
It
we're
was
not
like
talking about it.
Yeah, nobody. It was there, but nobody was talking about it. But now it's discussed openly.
Yes.
So as I told you, we just started India's largest menopause program for one of the employers. It's a large MNC. 2,200 women
Right.
will be taking our
Menopause
menopause
program.
program above the age of 35. It is being sponsored by the employer to all their women employees, 35. So
Great.
there is enough awareness now. Every woman will go through it eventually.
And also, as I
100%.
said earlier, the lifespan after menopause, because menopause is also setting in early. So your best, these are called the golden years, where your kids are settled, you are
Right.
in one of the best positions at work, and then you start leading your life on your own terms, right? But then menopause comes in. So I think that
Yes.
it's very important to have a good lifestyle even post your menopause. So
Right.
I think that sort of awareness is happening, and people are realizing that they need to do something about the symptoms to
Right.
lead a good life. So,
Yeah. And women, actually, the hormonal things never ends,
no,
right?
Yeah, yeah.
it just
That's
goes
what
on and on.
differentiates. See, men don't go through hormonal changes, and that's the reason we started.
Right.
60 to 70% women issues are preventable, curable. The two
Right.
topmost cancers in India, out of the five, breast and cervical, are 100% curable and preventable. Still, every 8 minutes we lose a woman to these two cancers.
Right.
Aditi has gone through twice.
Yeah.
Yeah.
So the point I'm trying to make, if you detect early, you can survive. There is a good life.
Right.
Yeah.
Right, the first time she got at the age of 25, and way back in 2008. Now
Yeah.
we're 2024. She's healthy and touch wood, healthy and hardy in front of you.
Right.
So medical science is advanced, but you have to catch early.
Right.
Now it is metastatic or grade 3 and beyond or grade 4. Then it becomes tough to and that's what happens in India. As she said, people have a lump.
They don't
forget
talk about
They
it.
don't cure it,
Yeah.
and then you're like last stage.
Did you also realize, did you feel any symptoms when you were going through this experience?
No, I didn't feel any symptoms. It was just a lump that I felt,
Okay.
and I thank
We just
God.
got married and
Yeah.
we were just sitting together. It was 4
And I
months.
said that there is a lump
Now I
here.
said, let's go to the doctor.
Next
And
morning, we were at the doctor's, and within
Oh.
2 days, they said that this is cancer.
Oh my God. So just in 2 days.
Just in 2 days, they
Yeah,
did
yeah.
all the
But
tests.
So
then
it
And
was developing, which you didn't know.
Yeah.
How would you know,
But
right?
the second time which came, it was surprising, and I think, I don't know, we never spoken about it openly, but we felt cheated as a couple because some of our health, pregnancy is kind of one of the triggers for a comeback of cancer because your body goes through hormone changes.
I've never
Estrogen-
heard this, but yeah.
Estrogen gets formed, which is
That's
a high growth
great.
hormone,
Yeah.
and malignant cells, dormant malignant cells in your body
Right.
in activity. There's enough research now from Addison, Hopkins, and all,
Right.
and none of the healthcare providers told us. So we could have taken a choice. We could have done alternate
Exactly.
ways.
Yeah.
And I think that is also one of the trigger points for us that if people like us who live in a big city,
Exactly.
access
Going to one of the best doctors.
and if we are not made aware, then forget about the rest of the country. I think
Right.
that actually was one of the triggers because we were not expecting that with her pregnancy, the cancer will come back.
Right.
Yeah.
So,
But the
must be-
second time the cancer came back, I think from the lump, I knew that it is cancer. So I remember going to the doctor, and he said, "Are you planning to go somewhere?" And next day only we were going to Mauritius. And I said, "Let me do this holiday and then I'm all yours." So we went, we did like a 5 days trip in Mauritius. And we
Right.
came back, and then 1st of January, my first chemo was there. So,
2021.
yeah. So then
Right.
we
20,
started.
yeah. So I think breast cancer, it is advisable more self-examination early on. and-
Yeah, self-examination is the
and
only way that you can.
early on.
How
and
often do you do that?
monthly. Every
Okay.
month you should
Yeah.
you have to just after a shower stand in front of the mirror and observe your breast, right?
Yeah.
And cervical cancer, we often say that at least if you can afford, get the HPV vaccine. It's
Yeah.
now readily available in the
Right.
country. And the second thing is at least get a pap smear done every few years, every 2 years or 3 years.
No,
and
5 years. 5 years
like
is
for
also
young
enough.
girls is 5 years.
Yeah.
I'm talking about more 35 plus and all.
Right.
And if there are enough tests, these are not expensive tests, 500-600 rupees from a good place.
Have a gynecologist for yourself. I think
have a-
that is my message
Yeah.
to all the women. Most of the women don't know who to go
Who
to.
to go to. They don't know.
100%.
You know?
Having someone you can trust
Yeah,
and
having
who
someone
can
you can.
guide you
Yes.
on science-backed solutions.
Yes.
Right. Yeah.
And not, sorry to say Dadi can escape because while Dadi lived her life, the times were different.
Time was just different. Yes.
Lifestyle is very different.
Yeah.
Mother also would know few things, not everything.
Right.
So go to a gynac, go to a doctor. I'm openly saying we run a free helpline.
Yeah.
Right.
You can come
get
to
a free
us.
consultation.
That's amazing. I think this is one of the highlight of the podcast for me as well. Like,
Yeah.
there are many women who are probably hesitant and they don't know, like,
Yeah.
of course, probably for young girls, like I might have to spend 1,000 or 500 or they're a little scared.
Yeah.
So having that first consultation with, of course, give
It
them
makes a huge difference.
difference.
Yeah.
Yeah.
and it's absolutely safe. Your identity is secure
Right,
because
yeah.
it's digital, and you don't come on a video call. If you want, you can do a video call with us, or you say I don't want, and you
Yeah.
just do a telephone call.
You have a very strict guidelines on
Yeah, yeah,
data
so
privacy too.
Yes.
Yeah,
data
which
privacy,
is good.
so it's
Yeah.
completely secure, and your data is not going anywhere.
Great. Amazing. So we are done. Thank you so
Thank you.
much.
Thank you for
Thank you,
inviting
Navneet,
us.
for this.
Yeah.
And I'm sure you are doing a great work here, and you are, getting all these stories to everyone. And I think that's commendable.
Thank you so much. I remember when I started Aditi and I had a first conversation.
Oh, yes.
And in fact, we recorded podcast
Yes, we
also.
did, we
and
did.
that was my first podcast I recorded with Aditi, but that didn't come good
Yeah.
because it was also my first time.
Yeah. I remember you were sitting in the studio and,
Yeah.
trying to figure out what is happening.
Yeah.
So,
But I'm so glad we could meet today. And thank you again for sharing your journey. And I wish you all the best.
thank you so much, Navneet.
Likewise.
Thank
Thank
you.
you.
Be part of the ecosystem now.
Yeah.
Absolutely.